been in pain. I've been puking. I've had abdominal pain that you wouldn't believe. Feels like my midsection was put in a garbage disposal. I can tell a million professionals my pain's at a 10, and they document it and do nothing with it and keep passing me off in this circus that is Avita healthcare. I'm going to explain all of my appointments in chronological order and how they all gave me the same result and how I'm still seeking for answers, still seeking relief for the diseases I have that you guys won't help me with. So we're going to go down through my little list of things I wrote here. My hospital visits that I can recall, okay? The first time I complained about my abdominal pain and pelvic pain and puking was in the ER in Mansfield at Avita Mansfield ER. My doctor did a chest x-ray and said you're probably sick or have a flu or something and let time pass. And I told him, I promise you this will come back. So I needed a doctor and they wouldn't give me one. So they gave me a follow-up doctor. I saw the follow-up doctor. He put me on a gut motility drug called Reglan, said that it would be a reset for my gut, and all it did was upset my gut more. And he tried to deter me from going to pain management because he said they'd ruin my life and put me on drugs that I didn't need to be on and that this was a simple fix. So I finally got hooked up with a primary care provider who is a physician's assistant. He's not a doctor, a physician's assistant that specializes in diabetes, and I asked him what he could do for me, and he referred me to a gastro doctor. That doctor did a colonoscopy for me, and by that time I had walked off my dental assisting job where I was getting paid well. I signed up for Molina Insurance, and ever since then it's been a shit show. I expressed how sick I was to my primary care provider. I went to a gastro doctor. He did a colonoscopy and an endoscopy and told me I had irritable bowel syndrome and that if I stayed away from meat, I might feel better. But I've been a vegetarian my whole life, and a lot of my family told me that I wouldn't feel this sick if I just eat meat. So I asked them if I needed a feeding tube. They gave me heart monitors. They put me on acid reducers like omeprazole, and I was still getting sick. So then I found out about endometriosis, and it's a disease that's gynological, so I need to see an OBGYN instead of a colonoscopy doctor to check out my intestines. I needed my uterus checked out, and I've given them endless blood, endless pee, endless information, and nobody does anything with it. So my OBGYN, I beg him to cut me open, and he's not even there for the appointment. He was giving birth to a baby, so I missed my first really important appointment with him and told him how I really needed that appointment and how terrible it was. So then I went to the ER and with pelvic pain, and they gave me a pelvic exam, and then they called the cops on me. And then the cops came out here to do a wellness check on me, and I told them I was mad because the guy who released me gave me a WebMD printout telling me that if I'm feeling pain unlike anything I've ever felt before, to go to the emergency room, which is where I was. So I waited on my OB again. I met him. I told him he needed to cut me open. He gave me a laparoscopy, and he found endometriosis, and he said that I have interstitial cystitis, which is like cysts on my bladder without infection. I just feel it, but I don't have any evidence of it. So I have a lot of gynological problems, and I've been trying to tell him about them, and he hasn't done anything. So I got fed up, and he passed me off to a urogynecologist who put me on a Aleve 500s, and I told him I've been on every NSAID to the point where my gut's destroyed. So he stopped giving me those and told me to try out Benadryl for 6 weeks, which I did, and I've tried everything that they've thrown at me that has masked my symptoms, and it's done nothing for me. I've thrown up a lot of Zofran, and I've expressed that this will never stop until you get rid of the endometriosis. They've tried to mask my endometriosis with birth control, and they gave me a menopausal shot. I've been on chemotherapy drug that has halted my hormones, and apparently I had to see a psychiatrist and talk with her. And I saw a psychologist, and she said I have PTSD. No kidding, because these appointments never go well, and I've gotten nowhere the 50 or 60 times I've asked somebody to help me get somewhere, because it's bad enough that I could go to the ER every day, and I've tried to be mature enough to set up with professionals and go through surgery and their protocol, and they still haven't even met me halfway. I'm going to read an actual email between my doctor and my nurse and myself. So here's my emergency emails to my OBGYN. Since I have gynecological problems, I keep going back to him, and he keeps doing nothing for me and pretending to. I said, hey, this is Tiff. I went to Catalyst Life Services in Mansfield for a psychiatric evaluation for mental illness. My evaluator said I scored approximately a 70 on my mental health test, and that she doesn't see signs of mood disorder, although I am having mood swings hormonally. She thinks I'm showing signs of PMDD, and she is sending me to a case manager and a psychiatrist to reevaluate my medications. I have a shot to meet pain management on Monday to try to address my continuous pelvic pain. I'm trying to keep all of my doctors up to speed so that I can gather a plan of treatment to move forward with these findings. And all I got back was, hi Tiffany, thank you for updating us. Dr. Huggins is out of the office until Tuesday, May 28th of 2019. I will update him then. Thanks again, Amy, registered nurse. So, okay, well, thanks for telling him that. Still don't know what that means, you know. So I asked, what would Dr. Huggins recommend for PMDD? Because I had an evaluator come to the conclusion that I have that, and it's an intense form of PMS. And I took one Lupron shot, and its effects are wearing off. I was taking Lupron for endometriosis. The side effects were really bad and seemed to outweigh the good, but I feel like my estrogen production is coming back at me full tilt, and I don't know if I should continue it once more because of the PMDD also being an issue for me. I see the psychiatrist on Monday if there's any psychiatric drug that you can offer me for PMDD, like an antipsychotic or something. But as far as hormonal drugs, I want to know what my options are. So they said back, hi Tiffany, I spoke with Dr. Huggins, and he feels that since you're seeing a psychiatrist, their office would be best at prescribing any medication. Thank you, Amy. So I said, is PMDD a mental health problem? Because PMDD is commonly defined as an endocrine disorder, meaning that it's hormone-related disorder. So psychiatrists can prescribe and administer gynecological-related shots and medications. And they said back to me, hi Tiffany, treatment for PMDD is usually an SSRI medication such as Zoloft. Dr. Huggins stated that since you're scheduled with a psychiatrist, that their office can prescribe this medication. Also, their office may recommend other modalities as well. Thank you, Amy. So I said, whatever, Lupron and birth control are PMDD treatments too, and I want my records released so I can go find a new OBGYN on my own because you people are so passive-aggressive and unhelpful. And she said, hi Tiffany, I'm sorry to see this message. If you would like to schedule an appointment to discuss the PMDD with Dr. Huggins, the office would be happy to do this. If you do want to transfer your care, we would need you to sign a release of records here, or have your new provider fax a signed release records to us. Thank you, Amy. And I said, so you couldn't have said that in the first place. When she said, if you would like to schedule an appointment to discuss PMDD with Dr. Huggins, our office would be happy to do this. So she couldn't have said that in the first place when I asked what he does for PMDD patients. I had to threaten leaving for you to even pretend to acknowledge my gynecological needs. I've been on Buspirone, Buspar, and I've been on Zoloft, and I'm on Seroquel. I've been on plenty of SSRI and antipsychotics, and if anyone would read my chart as to why I even bothered with an OBGYN in the first place, It's because none of the brain medication was helping my pelvic or abdominal discomfort. I've had 3 gynecological problems diagnosed, but hey, let's throw TIF's care into the realm of mental health, because that makes total sense. And then I said, I swear if this psychiatrist says I'm doing all I can do and recommends that I get some gynecological care, I'm going to lose my mind. Just mail me the stupid record release papers, ex-patient. And she mailed me the record release paper, and I signed it, and I mailed it back. And my records have not been released to my primary care physician where I asked. And I asked my primary care physician to give me a new OBGYN, and he sent me to a Dr. Minnie Somasundaram, which is somebody that I wanted, who went to school at OSU, and she is an endometriosis expert. But I guess she doesn't take my insurance, so the lady just lost my referral for an entire month before I had my referral repassed off to somebody down in Columbus. I asked my urogynecologist to put his feelers out for endometriosis experts, and I tried to ask for them, and they told me that they could not give them to me, but that they could get me in August 1st for a consult, to just have a consult to talk about the next person that might take on my gynecological problems, who probably won't immediately prescribe me what I've been needing since October of 2017. And I've been asking for help since October of 2017, and I haven't received any help since October of 2017. And I even saw the psychiatrist at Catalyst Life Services, and she told me that she can't even prescribe Valium 10 milligram to try, because it is an anti-anxiety, but it's a benzo, and I guess she can't write a benzo. And she said that everybody else could write that for me. And pain management said it was okay if the psychiatrist did. And pretty much all of my doctors said that the psychiatrist could do that for me. And she told me that pretty much anybody who's dealing with my gynecological problems could do that for me. So nobody's doing that for me, and I am going to take action at anybody who's stopping me from getting that accomplished, because it's been 600 days of me being more than chill about my pain and discomfort. And I've gone to all these appointments, and I've wasted hours and thousands of dollars and so much sanity and time and health I can't even tell you. And I still feel like crap, and I still hate Avita, and I still need an OBGYN. And I've been asking for one to handle my problems since October of 2017. So this is July 4th of 2019. It's been a long freaking time. Why I can't have it?
Because it's for the vaginal cramping. It's medical, and your doctor could have prescribed that. That's a benzo.
He can't e-scribe it. He told me he couldn't e-scribe it, and I can even show you the email if you don't believe me.
Oh, I believe you. I don't believe him.
Believe who?
Whoever told you he couldn't e-scribe it, because you can.
He's not an OB. He is a urogynecologist. He is my bladder specialist.
Valium can be e-scribed.
No. Then if it can, how come you can't e-scribe it?
Because I can't e-scribe it for that problem that you're having.
Can you e-scribe it for my anxiety if I eat it?
No, because we don't do those here.
It's on my compatibility.
Right.
Right here.
But
Right here, it's on my compatibility that I can take it.
I know you can take it.
For psychotropic. Psychotropic. It doesn't say for vaginas. It says for your head.
Right.
Right.
We don't prescribe those here at Catalyst.
So, can you, on the phone, call Charlie Davis, my primary care physician, and say that you agree with pain management and everybody else that he can write that for me so I can go do that, because I'm done here. There's nothing else I can talk about here with you. I need somebody to assist me to get Valium for my vagina. I have no OBGYN. I am waiting on an OBGYN in August. I am waiting on my pain shot at the end of July.
If you can't get him, I can't get him.
I can get him.